My name is Dr. Stanley Lau, and I'm a cardiologist serving in the San Gabriel Valley. This message is being delivered during the very difficult time that we all come to experience. We want to address all those who feel helpless or trapped throughout this period of uncertainty and worry, especially the people in this community. As an attending physician for local hospitals in San Gabriel, Arcadia, Alhambra, El Monte, and as the emergency response team leader at the medical center in Monterey Park, it is important to me that I provide you with the facts about how COVID-19 has been affecting our community. I know that as each day passes, we see this number grow for those infected and in deaths. We've been fortunate that there has not been a dramatic surge of patients in our emergency room with COVID-19. We, however, cannot say that this won't happen, and our job on the emergency response team is to be prepared whether or not it does. We do anticipate the surge to come within the next 10 days. Since the outbreak in December, we have mobilized the many efforts and skills of those in the surrounding area. The hospital has been screening, separating, and monitoring potential risk to our staff and our patients. Though this pandemic has disrupted so many lives, we cannot neglect those in need of non-COVID-19 related care. As such, we train and update our teams of healthcare providers regularly on how to protect themselves and our patients. And that would include understanding how to use the approved protective equipment, when to implement recommended procedures and methods to mitigate exposures and infection. Backup wings with extra beds for patients overflow have been prepared in isolated units of the hospital, and we will continue to follow the situation closely as it affects not just us, but the rest of the world, so we can continue to be prepared. We all read the headlines and may feel as though we've been bitten by this, but that is not the case. As a society, we have been persevering in finding a way to overcome this crisis. This means we must continue to practice all forms of recommended actions. This means it is absolutely imperative we continue social distancing, washing your hands in warm water with soap, and wearing face masks, that we are proving that we are not helpless, and through our seemingly small actions, yield the necessary conditions to stop this virus. For those watching and know who I am, and for those who don't, I want to thank you for taking this time to hear what it is I have to say. I also want to thank all who have donated to help support your local medical teams. And whether you are at home, at work, or out grocery shopping, please take the time to thank and support all healthcare workers serving you. I will continue to do what I can to update the people in this community in these coming weeks. Thank you very much.